One reason that you may seek help from an ear, nose, and throat doctor is vertigo. Vertigo means that you have a false sensation of movement, meaning that you feel like you're moving when you're not, or that the room is moving when you're not. Dizziness is a little bit different, and that dizziness usually means that you feel lightheaded, like you're going to pass out or faint, or versus vertigo is a sensation of movement. There are many different things that cause vertigo, and as a physician, I break it down into how long that vertigo is affecting you. So often you'll have vertigo that lasts seconds to minutes, especially if you feel like when you roll over in bed or you sit up quickly, the room spins and stops after a minute. This is often caused by a crystal in the inner ear that gets out of place. And when you move your head, there's a small canal that detects movement, and there's fluid in this canal. And when the crystal gets in there, it causes turbulent waves that make the tiny little hair cells detect movement, send erroneous signals to the brain that makes your eyeballs spin. That's why your eyes spin when you roll over in bed. It's a reaction caused by this crystal. And that can be easily treated in an ENT's office with a maneuver called a Epley maneuver. It can also be seen and done at home once you've been taught to do this by an ENT or a physical therapist. Other types of vertigo that have spinning that lasts minutes to hours, most commonly is one called vestibular neuronitis, which is a viral inflammation of the inner ear. It can cause severe spinning that lasts minutes to hours, nausea and vomiting, and it often takes many people to the emergency room because in rare cases, severe vertigo lasting minutes to hours can be the sign of a stroke. So I always recommend that if you have severe vertigo like this, you seek immediate medical attention. If you do have a viral inflammation of the inner ear, it can be treated sometimes with steroids, but with something like meclizine, an anti-vertigo drug. And over a course of days to weeks, the symptoms fade off from severe spinning after several days to feeling off balance to back to normal. I would caution you that if you have a sudden loss in hearing with vertigo, you need to see an ENT immediately because you may need high doses of medications to help try to bring this hearing back. Other reasons to have vertigo, to have this spinning that lasts minutes to hours, especially if it's chronic, meaning that it comes back time and time again, is something called Meniere's disease, which is an imbalance in salt in the inner ear that can cause fullness in the ears, ringing in the ears, fluctuating hearing loss, and the sensation of spinning lasting minutes to seconds. That can be easily be treated with medication and a restrictive salt and low caffeine diet. Other causes of vertigo, which is probably the most common reason for people to have recurrent vertigo, is actually due to migraines. Recently, it's been noted that migraines, not only can they cause you to have headaches, but they can affect other parts of the brain and they can cause vertigo. And between diet changes and medications to treat migraine, this can often be treated by an otolaryngologist, or sometimes you may be referred from an ENT's office to a neurologist to treat this. Sometimes you may need imaging, such as an MRI of the brain, to evaluate this. And anytime you come to an ENT's office for vertigo, you're often going to get not only a full exam, and this exam to look for a crystal out of place in the inner ear, but also a hearing test or audiogram.